to know I'm so grateful that you invited me to speak, because it is my passion to educate as many women and doctors as possible about breast cancer, how to find it early, and reduce the deaths and suffering that can occur when breast cancer is not found early. So I'm going to give you a crash course on breast cancer, the options for prevention and screening, and I will also introduce you to an important issue of dense breast. But first, I'm going to start with the basics.
May I translate? Dr.
Go ahead. Yes.
大家早晨。啱啱咧Ping咧就同大家講咗一啲網上邊講座需要注意嘅事項，咁咧都同大家介紹咗Gordon 醫生喺呢方面嘅經驗。咁 Gordon 醫生咧就同大家問早晨，同埋咧好開心，同埋好感恩有今次機會同大家分享，因為佢咧自己咧就依家係好注重呢種乳腺癌嘅及早預防同埋及早發現嘅，咁樣可以減低人口嘅傷亡，同埋大家可以更好嘅生活質量。所以呢個講座係好重要，咁佢就好感恩今次咧可以同大家分享一下大概非常之重要嘅一啲簡短不過非常重要嘅信息，供大家參考。好 ，Thank you, Dr. Gordon. Carry on, please.
Okay, let's see if my slides are going to advance. Okay, I'm going to have to do it this way. There we go. So I want you all to know that I'm here on a volunteer basis, and I'm not paid by anyone to give lectures about breast cancer. And when you do ask some questions in the chat, I hope you'll keep them to very general principles. I'm not going to give individual medical advice, but I do volunteer a lot, and I volunteer as the medical director of Dense Breast Canada and an American website called Dense Breast Info. So you'll hear more about that later.
大家好，咁啱啱咧 Dr. Gordon 就俾大家一個聲明啦嚇。其實我自己都係有聲明嘅，就係我哋今次咧全部都係義工形式嘅，就冇任何嘅私人嘅聯繫同任何機構啦，亦都唔會有任何嘅即係內部信息，一切呢啲信息咧都係從公共嘅渠道嚟嘅，同埋咧佢會提到兩個組織，一個咧就係Dense Cancer Canada， 同埋仲有一個美國嘅，所以大家咧一陣間都會聽到呢啲信息。不過Dr. Gordon 就提醒大家啦嚇，如果一陣間喺講座最後問問題嗰時咧，就盡量冇問自己啲嘢，因為呢啲咧講座咧就係全部係普通信息嚟嘅，即係大眾都知道嘅，就冇問個人嘅信息。好嘅，同埋咧佢係冇收費任何嘢，佢今次都係要volunteer 咁樣嘅，係義工形式嘅，所以佢就想等大家了解，同埋我自己都係義工形式幫助佢哋翻譯嘅。Thank you， 大家。Carry on, Dr. Gordon.
Here's what we're going to talk about today. I'm going to tell you what cancer is, what the signs of breast cancer that you might be able to look for, the importance of early detection, and how we can screen for breast cancer. That means look for it even before it's big enough to be felt as a lump. And I'm going to talk about dense breasts.
早晨，咁Dr. Gordon 今日就同我哋分享呢5點啦嚇，乜嘢係癌症啦，同埋有啲咩症狀咧？咁呢啲症狀我哋點樣知道係同癌症有關咧？同埋嗰個早期發現嘅重要性啊嚇，咁佢咧都會同我哋講下乜嘢係乳腺癌嘅screening 咧，即係點樣去篩查早期篩查，同埋佢都同我哋解釋乜嘢係 dense breast 咧 ，dense breast 一陣間我哋就可以仔細聽下呢個詞唔係大家咁熟悉嘅。Okay, carry on. Thank you, Dr. Gordon.
Okay, so breast cancer is a disease where some of the cells lose the normal control and they grow, usually into a lump, but not always. And they can go into the tissue next to the lump, and they can even spread to other parts of the body. Now, many cancers, and breast cancer, can be found before that happens and when they can be more easily treated.
好，咁啱啱大家有聽到 Dr. Gordon 咧就講呢個 PowerPoint 呢度咧就講乜嘢係乳腺癌啦。咁咧呢個乳腺癌嘅定義好重要嘅喎。咁佢就話咧乳腺癌咧，佢話呢啲細胞咧係非正常嘅增長啦，即係已經好似嗰啲雜草咁樣開始亂生咁樣噶啦。 咁呢個咧非常不正常嘅細胞咧開始生長嗰時咧就變成一個嗰啲結啊，即係大家可能感覺到有粒嘢喺嗰度嘅，同埋咧佢係可以入侵到周圍嘅組織嘅。咁佢周圍嘅組織咧入侵到咧，你又會覺得嗰個結越嚟大咁樣喎。同埋咧身體組織其他地方啊，譬如講淋巴結啊、肺啊、骨啊、腦啊同埋肝臟咧都會受到影響嘅喎，有可能嚇。咁咧如果係好多癌症咧，可以早期發現轉移到其他身體地方咧，咁咧我哋可以增加佢容易治療嘅機會啦嚇。Thank you, Dr. Gordon.
So who gets breast cancer? Well, mostly women, but not always. And women of almost any age, very, very rarely. Breast cancer can even occur in teenagers and women in their 20s, but mostly women who get breast cancer are older. And we know, I will talk a minute about some of the risk factors for breast cancer and why some women are at a higher risk than average. But I want everybody to understand that 85% of the women who get breast cancer have no family history or other risk factors.
好，咁今個 slide 咧醫生就講啦，咁通常多數情況嚟講咧，乳腺癌咧係女性有嘅，嗱任何年紀都有嘅喎。青少年都有可能發生嘅喎，咁咧佢一陣間都會同大家講有乜嘢係高危群體啊，同埋咧不過總數嚟講咧，普遍嚟講咧85%嘅女性咧有乳腺癌咧係冇家族史嘅喎。Thank you, Dr. Gordon.
So there are some myths around breast cancer, and some women tell me that they don't have to go have a mammogram. They don't have to have screening because there's no one in their family with breast cancer. But I want you to remember that most women who get breast cancer have no family history. So all women need to be screened.
醫生咧佢就講嗱，有時啲大眾可能有啲誤解或者係誤傳，就覺得我唔需要去做呢啲早期嘅篩查啊，因為又冇家族史啊，咁咧。其他又冇乜其他嘅影響，不過咧，醫生就想提醒大家啦，因為好多係冇家族史嘅，所以咧佢認為咧就建議大家早期嘅篩查係非常之有必要嘅。Thank you.
And in another myth is that I sadly hear from women sometimes in their 20s or 30s that they didn't go to the doctor when they found a lump in their breast because they assumed they were too young to get breast cancer. And any woman who gets a lump and it's something new for her should go to the doctor and get it checked because even young women occasionally get breast cancer.
醫生咧就喺度講啦，咁咧佢經常睇到20歲、30歲嘅女性咧，就算佢哋覺得點解嗰個乳房胸部嗰度有個結咧，有個核喺嗰度咧，佢都唔想去睇醫生，因為覺得自己咁年輕應該唔會有癌症啩。咁咧，醫生就強調啦，大家一定要去如果發現有嗰個胸部有呢啲結嘅喺嗰度咧，一定要早期睇醫生嘅嚇，就及時睇醫生。Thank you, Dr. Gordon.
So rarely men can get breast cancer too. About 1% of all breast cancers occur in men. So even a man who feels a lump in their breast should go to the doctor and get it checked.
醫生又提講啦。大概1%嘅男性咧，唔係，大概1%嘅乳腺癌患者可能都係男性嚟嘅，所以咧，如果就算男性有胸部嗰度咧發現咗有一個結咧，有個核喺度咧，都應該係即刻去睇醫生嘅嚇。Thank you.
So you may have heard the statistic that 1 in 8 women will get breast cancer, and that is accurate, but it's not across all ages. Breast cancer is very rare in the 20s. It gets a little more frequent in the 30s, and it gets more common as women get older. The older you get, the more risk of getting breast cancer. So the magic number is age 40, because age 40 is where there's a bigger jump in the incidence of breast cancer.
嗱，醫生就提醒我哋啦，從數據嚟睇咧 可能有啲人就聽過啊1%嘅婦女會得癌症咁乜乜乜，其實咧佢嗰個年紀咧好有關係嘅。嗱就係大家從呢個數據上邊睇到啦，咁佢就睇到40歲嗰個咧就係比較高發嘅年紀嘅，所以咧數據就顯示我哋隨住年齡增長啦，咁我哋患上乳腺癌嘅危險性咧就更加高㗎啦。
And so here's another myth. Some women tell me, oh, I didn't think I needed to keep having mammograms because now I'm 65 or 70 and I don't think I need them anymore. Well, it's the opposite. If you don't die of something else first, your risk of breast cancer keeps rising, as you can see in these numbers. So as long as a woman's in good health, she should keep having mammograms.
醫生又強調啦，咁就算係年長嗰啲女性咧，就覺得有時諗，哎呀唔需要啦，咁多年都冇得，咁依家唔使啦。咁其實醫生就提醒我哋咧，早期嘅篩查咧，早期去做乳房照影術咧係好有必要嘅。尤其如果我哋上咗一定年紀咧，就其他嘢冇攞咗我哋嗰條命咧，咁我哋係得乳腺癌嘅機會咧就更加高㗎啦。所以佢就強烈建議就每個人都應該係早期篩查同埋乳房造影啊咁樣嘅。Thank you.
So I mentioned that 40 is the magic number, and that's when breast cancer starts getting more common. So it turns out that 1 in 6 breast cancers are diagnosed to women in the 40s, and 41% of the years of life lost to breast cancer are women diagnosed before age 50. An important fact for this audience is that Asian women, and also Black and Hispanic women, but Asian women tend to get breast cancer younger than white women. Their peak incidence is in the mid-40s. So women with Asian ancestry should be having mammograms absolutely starting at age 40, unless they have a strong family history, in which case sometimes they should start earlier.
嗱，咁醫生咧喺呢一章上邊佢就講個好重要嘅信息喎。佢話咧40歲咧係啱啱我哋講比較重要嘅年齡層段啦嚇。咁咧佢都話咗6個人當中其實有一個乳腺癌患者咧都係喺40歲嗰時診斷嘅。咁佢又提到好似亞洲女性啦，包括同埋黑人嘅同埋西班牙裔嘅咧，其實咧都係好多佢嘅係早期40歲以前或者係40歲就已經有乳腺癌嘅症狀㗎啦。同埋咧，大家睇到佢個PowerPoint 上面都寫咗41%嘅呢啲年輕人咧都死於癌症嘅，同埋咧50歲之前就死於癌症嘅。所以佢咧就建議大家40歲咧係一個比較重要嘅年紀，尤其對亞洲女性嚟講咧，應該去做早期嘅篩查，同埋咧，如果係有啲家族史嗰啲咧，可能篩查嘅年紀要提前添喎。Thank you, Dr. Gordon.
Okay, so this slide basically repeats what we just said, and that is that the peak incidence for Black, Asian, and Hispanic women is in the mid-40s, which is about a decade younger than white women, whose peak incidence is in the early 60s. Also, Black and Hispanic patients have more advanced cancers than white or Asian women. And that's why we have to pay attention to race and ethnicity when we're giving recommendations for screening.
嗱，醫生咧喺呢個 PowerPoint 上邊就重複啱啱嗰個重點啦。咁佢就話咧，如果係群體啊，譬如講不同嘅族裔入邊咧咁咧如果係白人咧，佢可能早期60歲之前咧就係有個高峰期有乳腺癌嘅。咁如果係黑人群體、亞洲人同埋拉丁裔咧，婦女咧就可能係大概40歲中間嗰度就會好多咁嘅乳腺癌嘅患者。同埋佢都講咗黑人同埋嗰個拉丁裔嘅病人咧，佢咧可能就會有更加嚴重嘅癌症，比白人或者係亞洲嘅婦女。咁如果係黑人群體咧，佢哋40%啦咁咧可能都會死於乳腺癌嘅。Thank you, Dr. Gordon.
Okay, so the next couple of slides, I want to talk about risk factors for breast cancer. We're not all at equal risk, and there's some factors you can control and some you can't. Now, for example, you've probably heard of the BRCA genetic mutation, and that's what Angelina Jolie had, and some women are at very high risk for getting breast cancer. So having a BRCA mutation puts you at very high risk. Women who've had chest radiation for Hodgkin's disease, less than age 30, and then all these others like a family history, especially in a mother or sister, that puts you at greater than average risk. I'll let you talk about that first, Melody.
Thank you, Dr. Gordon. 嗱，Dr. Gordon 就提醒大家，佢啱啱有講到有一啲高危嘅因素咧，係我哋可以去控制下，有啲因素咧我哋就控制唔到。咁佢咧就會接下嚟就同我哋大家講，首先咧就講下前3部分嗰個就係 genetic mutation 呢個啦。咁佢就舉咗個例子，譬如講 BRCA 啊，呢個有個明星咧，佢咧都係有呢個高危嘅基因上邊嘅隱患喺嗰度。咁第2條咧就嗰個胸腔嗰個有啲輻射啊嗰啲治療嗰啲咧又係高危人群，同埋咧佢有個第3點咧就係嗰個胸部，尤其乳房嗰邊嘅組織比較多嗰時咧，就可能會有更多嘅呢啲隱患嗰度嘅。同埋咧，佢有舉咗啲其他嘅例子啊，譬如講有啲病咧都會引起呢個第2個嗰個胸腔嗰啲疾病嘅 radiation 嗰啲，增加咗佢嗰個危險性嘅。Thank you, Dr. Gordon.
Okay, now the column on the right, these are factors that you can control that could increase your risk of getting breast cancer. So you want to know about them. Women who take hormone therapy after menopause for a short period of time are fine, but some women stay on it a long time, and that can increase the risk of getting breast cancer. Women who have alcohol, we now know, is a cause of breast cancer. Alcohol, the more you drink, the higher the risk, or a high fat diet. Women who don't get exercise are at a higher risk. Women who smoke are at a higher risk. And women who are at a high body weight, higher than ideal, they're also at increased risk. So these are things you can control, and you can change your lifestyle to lower your risk of getting breast cancer.
好啦，咁咧啱啱醫生就同大家講，有啲隱患咧係我哋可以改變，有啲係唔可以改變嘅。有啲我哋可以改變控制咧，就其實我哋嘅生活嘅飲食啊嗰方面嘅。咁首先佢就講啦，譬如講，如果係我哋有喺荷爾蒙嘅治療啊，或者我哋食好多好脂肪高啊，同埋飲酒啊、吸煙啊，我哋又唔做運動咧，同埋我哋嗰個身體體重比較高咧，咁啊變得我哋個患乳腺癌嘅風險就高咯喎。所以佢就建議我哋可以從我哋嘅生活方式改變，因為呢啲咧係可以我哋控制到嘅。Thank you, Dr. Gordon.
Okay, so I find these really interesting. We want to find breast cancer as early as possible, but it would be even better if we could prevent it from happening. And if women modified their habits around the controllable risk factors, even if they wait until middle age, it's thought that 50% of breast cancers could be preventable. And even if women waited until their middle age, 68, if you start young, 68% could be prevented. For women who wait till middle age, as many as 50% of breast cancers could be prevented. Something like walking. If we think that if women walk, you can lower your risk. If you walk every day for 30 minutes, you can lower your risk by 20%. It will also lower your risk of colon cancer. It's all on the slide. Heart disease, stroke, osteoporosis, and depression. I'll let you catch up, Melody.
Thank you. 咁醫生就提醒我哋啦嚇，大家可以睇到佢嗰個 PowerPoint 上邊有寫㗎啦。咁佢咧就覺得如果係早期篩查咧，可以及早發現好。不過更加好嘅咧，就係我哋可以預防。點樣預防咧嚇？佢就分享啦。喺呢度咧，佢就話咧 50%嘅乳腺癌咧，其實係可以預防㗎嚇。如果我哋有一個比較健康嘅生活嘅習慣，不過咧就係喺中年之前喎。咁咧68%嘅乳腺癌咧，係可以預防嘅。如果我哋從細蚊仔嗰時咧，就保持一個健康嘅生活嘅飲食習慣啊、運動習慣，同埋佢就強調咧，如果每日我哋可以做30分鐘嘅運動咧，咁你睇下，我哋可以減低20%患上乳腺癌嘅風險噶喎，同埋咧都可以減低其他癌症，譬如講係腸癌啦、心臟病啦、中風啦、骨質疏鬆啦，同埋抑鬱症嘅風險噶噃。Thank you.
Okay, so another thing women can do, and maybe not many of this audience past the stage where they can breastfeed, but we should tell our daughters and we should teach young women that the amount of time spent breastfeeding can reduce a woman's risk of getting breast cancer. It's not only better for baby, but it's better for mother too, because if women breastfeed, ideally up to a year, not each child, but across all children, we could see a 20% drop in breast cancer risk from breastfeeding. Go ahead, Melody.
咁醫生都提醒大家，雖然我哋可能呢個年紀就唔會再去用母乳餵奶啦，不過我哋可以同我哋啲親人講，如果佢哋到時要餵母乳咧，最好就係1年以上，同埋咧佢通過母乳餵養咧，佢都可以減低20%嘅乳房癌嘅風險嘅喎。Thank you.
And for women who are overweight, it's never too late to lose weight and get to a more ideal body weight. And women who lose 10 pounds lower their risk by 10%, and women who lose 20 pounds lower their risk by 50%. So that's worth doing. Also, as I stressed, with each drink of alcohol per day, there's an increase in breast cancer risk. So we now know, even with the latest guidelines that came out, that people should try to limit their alcohol to less than 2 drinks per week, 2 drinks maximum.
嗱，醫生咧就同我哋分享喺右手邊佢呢個 PowerPoint 佢就講啦，咁咧減輕體重咧，其實佢嘅優點好多㗎喎。嗱，女性嚟講，如果我哋可以減少10%嘅體重咧，10磅到啦嚇，10磅嘅體重咧，咁我哋可以減輕嗰個風險10%嘅。咁如果我哋減咗20磅咧，咁我哋可以減低嗰個風險咧，患上乳腺癌風險50%嘅噃。同埋佢都提醒我哋大家，就係如果飲酒咧，每日飲酒咧，就會增加我哋患上乳腺癌嘅風險。咁如果我哋可以減低酒精飲品咧，咁啊最好。同埋佢都話啦，好似就係最好就係2次飲酒，每個星期減低到起碼呢個以下，咁就好啲。Thank you, Dr. Gordon.
So we talked about all those risk factors, and I want you to remember the most important ones. The most important risk factors for getting breast cancer are being a woman, number 1, and 2, growing older. So we're all at risk. And this slide says 75%. The other slide I talked about said 85% of women who get breast cancer have no family history. So we are all at risk.
嗱，醫生又提醒我哋啦，我哋所有人咧都其實係高危人群，因為點解咧？首先咧就係女性，第2點咧高危嘅因素就係隨住年齡嘅增長，所以我哋咧其實都係高危人群。咁咧佢就話呢個 PowerPoint 上面寫住75%嘅乳腺癌患者咧係冇家庭史嘅。咁之前我哋提過85%嘅乳腺癌患者係冇家庭史嘅，所以大家都要多留意呢個啊。Thank you, Dr. Gordon.
Okay, so now moving on to preventing cancer, we're going to start talking about early detection and what are the things that might mean that a woman has breast cancer. I'm not going to read every single one, but basically any change from a woman's normal is worth showing to a doctor and discussing whether any tests are needed. The one most people know about is when they find a lump in their breast, but it can be anything like dimpling of the skin. It can be sores on the skin, it being liquid coming out of the nipple. just a firmness that doesn't feel like a real lump. It's just that part of the breast gets hard, or any of these signs. And don't spend a lot of time on this, Melanie, because I'm going to show them a picture the next slide.
OK， 嗱，醫生咧就提醒我哋啦，啱啱講咗其他嗰啲高危人群嘅風險啦，今次咧我哋就開始講嗰個乳腺癌嘅有咩症狀啦。咁咧佢咧就冇全部概括，不過佢就同大家分享咗幾個比較重要嘅嚇。通常啲人就會覺得啊，個胸部乳腺嗰度咧，乳房嗰度有啲結咁樣嘅，同埋咧如果你發覺個乳房同平時唔一樣咧，其實呢個就係應該係睇醫生去睇下噶啦。咁啊，通常嗰啲咧就係發覺，點解呢度有個腫塊啊，或者成個乳房一部分咧變得硬啲嘅喎嚇。咁咧有啲咧就係點解有啲水流咗出嚟嘅嚇，同埋有啲皮膚咧又開始潰爛咁樣咧，同埋又紅啦又熱啦咁樣嘅嚇。所以咧同埋嗰個乳頭嗰度咧又有變化喎嚇。咁呢啲咧就係要及時睇醫生噶啦。咁佢話一陣間會俾大家睇下啲圖片嘅。Thank you, Gordon.
I'm going to show you two slides. The first one really quickly because these are real people, and I know some people find it distressing to see. But this is when a woman can see a lump in her breast. Well, that's already big enough to see. And here's where you can see the skin is puckered and pulled in. So I'm not going to stop. I'm going to go right to a different slide that's a little less scary looking. And this is a really good website, knowyourlemons.com. And it'll show you with a lemon all the ways that a breast cancer can show up. And women can look at this picture and look at the website and learn about what they might notice on themselves.
Thank you, Dr. Gordon. Are you able to go back to the previous slide?
Yep.
Thank you. 嗱，大家咧就睇到醫生咧，佢話呢個圖片咧就冇令到大家咁唔驚，一陣間佢就會有另外一個圖片俾大家睇。咁呢個咧就睇到喺上邊嗰度，佢指住嗰度已經有一個突出嚟嘅結，同埋有個地方咧皮膚係好似下陷咁樣落咗落去嘅嚇。同埋 next slide please, Dr. Gordon。嗱，咁呢個咧就唔會嚇到大家啦。不過咧佢上邊咧有好多不同嘅症狀，可以等大家更好咁樣從視覺上邊了解到嗰個乳腺癌好多症狀。譬如講啦，呢度結嗰度啦，同埋有啲乜嘢流出啲汁水啊，或者係嗰啲顏色咧變化。同埋咧，大家可以喺呢個網站上邊睇到嘅嚇。Thank you, Dr. Gordon.
Okay, so now we'll start talking about things that women can do to find breast cancer as early as possible. Now, ideally, we want to find it even before it's big enough to feel, but sometimes women find their own cancer, and we'll talk about that in a minute. But the reasons we want to find breast cancer early is to save lives, to prevent death, by finding and treating cancer earlier. But even when a woman gets cancer, if we find it earlier, she can have less aggressive treatment and still not die from her cancer. So that less aggressive treatment will mean a better quality of life.
嗱，醫生就同我哋講，點解我哋要及早咁樣發現乳腺癌咧嚇？不單單因為可以增長呢個減少佢嘅死亡率啦，同埋等佢個生命質量都好好多嘅。因為如果係早期發現咧，咁可以嗰啲治療咧都唔會咁傷人體嗰種。所以咧如果係可以早期發現咧，不單單減少咗人命嘅傷亡啊，增加佢個生活質量，同埋咧都係可以等佢延長佢個生命嘅。等佢冇咁早去即係唔見咗生命。Thank you, Dr. Gordon.
Sorry, I would jump the gun a little bit. So one of the things women can do is learn what their normal breast texture feels like. And then if there's ever a change, they'll recognize that something has changed. Now, this is not the right way to do this. It's just a picture to get me talking about it. And you don't have to check your breasts every single month. But you should check periodically just so you'll know what your own normal texture feels like. And the best way to do that is I'm going to leave you with this YouTube video. I won't play it because it takes too long, but you'll have access to the slides after because we're recording the talk. And this is a video made by Dr. Liz O'Riordan. She is the breast surgeon in the UK who's had breast cancer. And it's a 3-minute long demonstration of how to check your own breast. And she does it through a t-shirt. Don't worry, she's not going to be naked. But I recommend you watch it and learn how to do it.
好，咁醫生咧就同我哋大家講啦嚇，咁呢個圖片咧就唔係教大家點樣去做，不過佢攞呢個圖片就想同大家分享咧，就唔需要每個月都係自己去測嗰個檢查嗰個胸部嘅，不過咧最緊要你係多次啊，同埋你多次你就自己知道自己正常嗰時個乳房嘅觸摸嘅質感係乜嘢，因為你要知道自己平時正常嗰時乜嘢樣嗰時咧，你先至分到乜嘢係不正常嘅。所以佢咧就話一陣間咧有呢個YouTube 嘅3分鐘嘅視頻，大家可以睇。咁呢個 PowerPoint 佢到時咧會分享俾大家，所以大家咧唔需要即刻記低呢個，一陣間。編會俾大家睇呢個 YouTube 嘅呢個 link 同埋嗰個PowerPoint 都會分享俾大家，所以大家就醫生強烈建議你就花時間3分鐘啫，就睇下呢個視頻點樣自己去做乳房嘅自測嚇。Thank you, Dr. Gordon.
Okay, so the gold standard test to look for a cancer even before it's big enough to feel is a mammogram. And for those of you who haven't had a mammogram yet, this is how it's done. Each breast is compressed in 2 directions, from side to side and from top to bottom. And a low dose X-ray is taken in each position.
嗱，咁咧呢個圖片就講俾大家聽，如果係你未做過即係乳腺嘅造影術咧，即係你咧就知道佢咧就係2個不同嘅方向。同左同右同埋上同下咁樣照影出嚟，每邊嘅乳房都要咁樣做。咁佢嗰個放射線咧係好低下嘅嚇。Thank you, Dr. Gordon.
Okay. Now, I found these pictures online of what to expect a mammogram to be like, but I don't want you to believe them. The one on the left shows the technologist and the patient with big smiles and having a nice conversation. And I need you to know mammograms have to be uncomfortable. They should not be horribly painful, but the breast has to be compressed enough to spread out the tissue so that if there's a cancer, we can see it.
係啦，醫生咧就想大家睇下呢2張圖片咧，尤其左邊呢個2個人咧就好開心咁樣，咁佢就想大家知道下，如果真係做嗰時咧係有一定程度嘅不舒服感，不過咧就唔會好痛咁樣嘅。咁咧，大家咧就知道，因為個乳房咧一定要係有啲壓迫感嘅，所以大家咧心理都要有少少嘅預防，咁樣就知道唔會好似佢哋2個笑得咁開心。不過咧，亦都唔會話痛到咩咁樣嘅，大家自己心理有啲準備就得啦。Thank you, Dr. Gordon.
And this picture on the right is also it's very misleading. It shows the patient standing there with her breast compressed, and she's got her hands spread out. And the technologist is looking at the picture. This never happens. All mammography machines now are designed that as soon as the picture is taken, the compression automatically releases. So you're not standing there uncomfortable while the technologist takes her time.
好，咁樣醫生咧又同我哋分享，右手邊呢個圖片咧又係能令公眾好誤解嘅嚇。咁咧就唔會話企住喺度唔喐，咁另外一個操作員咧佢又睇到咁樣，唔係嘅。咁醫生就話分享咧就係呢個機器咧佢會壓迫嗰個乳房嗰個組織啦，然之後攞到圖片之後咧嗰個壓迫感就即刻自己鬆晒㗎啦。所以咧唔會企喺嗰度好似2隻手擺喺旁邊咁樣嘅，所以呢個圖片咧就係唔係真實嘅。Thank you, Dr. Gordon.
So mammography is uncomfortable, but most women who are past menopause, their breasts aren't so tender and sensitive anymore. For younger women in their 40s who are still having periods, that breast tenderness is usually worse right before the period. So we tell younger women who are having mammograms in the 40s, try not to schedule your mammogram when you're premenstrual. You should try to have the mammogram when you're getting to the end of your menstrual period so that it'll be less uncomfortable.
醫生就提醒我哋啦，咁呢個乳房造影術咧係大家都知唔會好舒服，因為佢壓迫嗰個乳房啊嘛。咁佢就建議啦，如果係好似年輕人仲有月經嘅咧，就最好唔好預約喺月經嚟之前嗰段時間，通常1個星期度啦嚇。就大家要知道，因為嗰時月經嚟嗰時咧，個乳房會好硬嘅，咁好硬腫脹嗰時咧，一壓迫咧就更加唔舒服啦，同埋。所以咧，如果係我哋年輕嘅女性仲有月經嘅，40幾歲都有未停經之前咧，都要注意唔好預約嗰個做乳腺照影喺你個月經前嘅一段時間。通常1個星期之前係月經嚟之前嗰時嗰個乳房會比較腫脹，同埋咧嗰個如果係停咗經啲人咧，可能就唔會有乳房腫脹。咁犀利，所以咧就可能情況就會好少少啦。Thank you, Dr. Gordon.
Okay. So here's what mammogram pictures look like. This is what the radiologist gets after the technologist takes the pictures. These two on the left are the breast being compressed from top to bottom. And these two are the right and left breast being compressed from side to side. And you can see they're not completely symmetrical. There's a white blob in the right breast. And that's a cancer in this lady. And you can see it here. And the reason we can see this cancer so easily is that cancer on a mammogram is white. And this lady's breasts, not everybody's, but this lady's breasts are dark gray. So it's very easy to see that white cancer. And I'm going to talk about more about this later.
咁醫生咧就分享呢個圖片俾我哋睇，就係乳腺照影術嘅結果啦。咁佢就睇到左手邊呢度咧，我哋啱啱有講係2個不同嘅方向影出嚟嘅，一個咧就係上同下，一個咧就係左同右。咁佢都講咗，嗱白色嗰個嘢咧，即係黃色箭頭指住嗰個咧，就係癌症嚟嘅。咁因為佢嗰個背景咧係黑色嘅，呢個白色嘅癌症咧就好容易睇出嚟。咁一陣間佢都會詳細再講下其他啲嘢嘅嚇。Thank you, Dr. Gordon.
Okay. So there's lots of research showing that we should all start having screening mammograms at age 40. And this study from Canada compared almost 2.8 million women in Canada, which represents about 85% of the population. And they found that overall, women who have mammograms are 40% less likely to die. And women in their 40s who have mammograms are 44% less likely to die. So that's an important study that should form the basis of screening policy in Canada. Unfortunately, it doesn't, but I want you to know about this study.
嗱，醫生咧就同我哋分享好多科研成果咧，就係講俾我哋聽，40歲嗰時咧早期嘅乳房嘅篩選咧好有必要嘅。咁呢個數據咧就話係280萬嘅婦女啦嚇，喺加拿大呢度咧。可以即係有代表咗85%嘅人口啦嚇，咁佢嗰個科研嘅結果咧就發現啊40%嘅係可以預防嗰個死亡嘅，即係減少死亡嘅，同埋44%咧咁啊減少死亡喺呢個婦女嘅年紀群體40到49歲之間嘅。Thank you, Dr. Gordon.
Okay. So here's some more research showing the importance of having mammograms. And this is from Sweden. And they showed that women starting at age 40 who have screening are 60% less likely to die from breast cancer in the first 10 years after diagnosis, and almost 50% less likely to die of breast cancer in the first 20 years after diagnosis.
嗱，醫生又同我哋分享第2個數據，係從一個瑞典嘅文獻出嚟嘅。咁佢都話啦，如果係診斷之後嘅10年之內啦嚇，60%嘅低風險嘅唔會死亡，從嗰個乳腺癌當中。同埋另外一個結果咧，就係 如果係20年診斷之後，即係診斷之後嘅20年之後咧，可以減低47%嘅死亡嘅風險喺乳腺癌患者當中。Thank you, Dr. Gordon.
Okay, so I'm just going to drive home this point that annual mammograms starting at age 40 save the most lives.
醫生咧就好強調啦，咁啊大家一定要記住，40歲嘅女性咧，如果係做年檢，就係可以減低死亡風險同埋挽救生命嘅。
Okay, so there are all kinds of guidelines. Let's skip this slide because it's just confusing. But I want women to know that sometimes their doctors are not recommending that they have screening in their 40. And that's because there's a panel in Canada called the Canadian Task Force on Preventive Healthcare. And these are their recommendations. They say women shouldn't have screening in the 40s. And I just told you that everybody should. They also say that after the age of 50, women can go every 2 to 3 years. Well, the fact is everybody should go every year. And if women are postmenopausal, then every 2 years at the least, but certainly not every 3 years. They also say that women shouldn't check their breasts, and I just told you that they should. They also say doctors shouldn't check women's breasts, and that one I'm not so upset about, but they also say that there's no additional screening necessary for women with dense breasts, and I disagree with that, and you're going to hear why.
嗱，醫生咧就同我哋分享咗2個 slide， 咁之前個 slide 咧就好多其他嗰啲專業網站上邊，佢話唔分享俾大家啦，嗰度咧就非常之令人即係都唔清晰嘅。咁呢個 slide 上邊咧，咁佢就講咗啦，咁好多係官方嘅建議啦嚇。咁譬如講頭一點咧就話就唔會建議40到49歲嘅女性咧就係每年都去做呢個。不過佢咧Dr. Gordon 咧佢就分享咗好多呢啲點樣官方嘅指引咧嚇，其實佢都會同埋佢其他醫生同事咧都會有自己嘅觀念，同嗰個病人自己係做最好嘅建議嘅嚇。所以咧佢舉咗幾個例子咧，上邊呢啲咧雖然佢寫咗呢個網上邊寫住話官方就話唔好做咁樣自己嘅檢測咁樣啦，其實佢Dr. Gordon 都唔係好同意呢啲咁嘅建議嘅。Thank you, Dr. Gordon.
Thank you. So here's what you need to know. The task force said that women shouldn't have mammograms starting at 40 for a couple of reasons. But one of the reasons, even though they know that if women don't get screened, more women are going to die, the reason they didn't want women to have mammograms in the 40s is they said that if a woman goes for a mammogram and she gets called back for extra tests, it's going to make her nervous. Well, of course it's going to make her nervous, but my argument is that women are going to be a lot more nervous if they're diagnosed with breast cancer and if it's not found early because they didn't have a mammogram. So every woman going for a mammogram should know that there is a possibility she will be called back. But out of every 1,000 women who get called back, 93%, for every 1,000 women screened, 93% are going to get a normal result and 7% are going to be called back for extra tests. But most of those women will only need an extra mammogram picture or an ultrasound, a small number. So 11 of the 1,000 women who had screening will need a needle biopsy, and those are done with local freezing, and that freezing is minimally uncomfortable for a short period of time. After that, the test is not painful. And of those 11 women who have the test, 4 of them will going to turn out to have breast cancer.
醫生又繼續同我哋講下，啱啱之前嗰個指引上邊咧，有佢咧就話，如果係有1000個女性被檢查啦嚇，大概有93%嘅人會有一個正常嘅結果，咁只有7%嘅人咧可能需要第2次嘅復檢，咁咧70%呢個咧 7%嘅呢個復檢嘅人咧，可能就會被要求做多一次嘅乳房造影，或者係超聲波嘅檢查。咁咧，如果16%喺呢個7%嘅當中，比較呢個數據比較麻煩，我重新解釋一下。即係如果係呢70個人當中需要重新再多做一次檢查咧，其中11個人咧就可能需要一個係叫做biopsy 嘅呢個組織嘅檢查咧，其實就係通過焗麻啦，咁啊唔會感覺到痛啦嚇，有少少痛，不過咧就唔會好痛嘅，因為有俾麻藥喺嗰度嘅。咁咧做完之後咧，嗰個仲有4%嘅人咧，從呢個局部檢查呢個組織檢查當中咧，可能會被確認為診斷為乳腺癌嘅。啱啱佢都有講啦嚇。咁呢個組織咧，點解話佢唔會建議正常每年都去40歲左右啲女性去檢查咧？因為佢嗰個理由咧就係如果係啲女性咧再重複去做第2次嘅檢查咧，佢哋會好緊張。不過 Dr. Gordon 咧，佢就話佢覺得應該係每年都去檢查咧，因為如果係呢啲女性真係確診咗癌症咧，佢哋會更加緊張嘅。所以呢個就係 Dr. Gordon 會即係建議大家每年去年揀去做嗰個胸部嘅造影咁樣嘅。Thank you, Dr. Gordon.
Okay, so I want the women attending this webinar are all in British Columbia, and I want you to know how lucky we are, because not all provinces let women have mammograms starting at age 40, but British Columbia always has. Not only that, we can start self-referring at age 40, meaning we don't need a requisition for a doctor to have a screening mammogram. But it's very important that women understand the benefits of screening that I'm talking about, because not all doctors understand that. And because of those task force guidelines that I showed you that are dangerous, some family doctors even tell their patients not to have a mammogram till they're 50. Well, I just told you before, especially Asian women need to start at 40 because their peak incidence of breast cancer is in the mid 40s. And our program in British Columbia, although it lets us start at 40, the one thing it could do better, it should allow all women to come every year in the 40s. And right now, the only women who can go every year are women with a mother or sister with breast cancer. So definitely start at 40 and don't miss a year, go as often as they let you.
醫生咧就同我哋講下，佢就話我哋真係好幸運啊！我哋喺 BC， 因為加拿大咧唔係個個省都有可以提供免費嘅40歲就可以去做乳腺造影嘅嚇。咁佢就分享到呢度，我哋咧呢度喺 BC 省咧，我哋可以自己去要求去做呢個乳腺造影，40歲嗰度唔需要醫生嘅轉介嘅喎。呢個我哋真係好幸運。同埋咧，佢想大家都要了解下，唔係個個人都認識到乳腺早期造影同埋嗰個篩查嘅重要性，同埋佢嗰個益處啊，包括有啲醫務人員，包括啲家庭醫生，可能都唔會意識到呢個係好重要嘅。咁所以咧，佢就話啱啱同大家講到有啲指引咧，都話唔建議。不過佢自己就認為係真係好有必要每年去做呢啲早篩嘅運動㗎嚇，即係行動嘅。同埋咧，佢話有啲家庭醫生可能會建議病人就唔需要做呢個乳房造影啊，50歲之後先至做啦嚇，唔需要40歲就做咁樣。不過 Dr. Gordon 咧就強調佢都係非常之有必要40歲就開始，就唔好話一年做一年唔做咁樣㗎啦嚇。同埋咧佢話有啲如果係母親或者自己嘅姊妹咧，即係女性嘅姐姐妹妹啊，都有癌症嗰時咧，佢可能嗰個做乳房篩，即係呢啲咁嘅檢測咧，可能會提前，都唔一定會40歲，所以呢個要大家了解嘅。Thank you, Dr. Gordon.
Okay, so I think I've said it over and over. We all should start at 40, but the question is, when should we stop having mammograms? And the task force says that women should stop at 74, but that's because the only research they looked at to make their guidelines happened to have women stopping at 74. But we now know that 74 is the new 54, and women are living longer and healthier. So the American Cancer Society says women should keep having mammograms as long as they're in good health and their life expectancy is at least 10 years.
好啦，咁醫生咧就又同我哋分享，啱啱嗰個 task force 指引咧就話就70歲之後啲婦女咧就唔需要去做呢啲每年嘅乳腺造影啊呢啲早期檢測噶啦。不過咧，因為咧就係因為佢哋個數據嘅人數嗰個年齡咧，其實就到70歲為止嘅，所以 Dr. Gordon 咧就提醒大家啦。我哋其實咧，如果係女性咧，生命越嚟越長，好似大家都睇到80幾歲啊，所以變得嗰個74歲呢個數字咧，其實就好似54歲咁樣噶啦。所以佢咧就會建議話，如果係預後即係仲有10年嘅生命咧，都應該堅持每年去做呢啲早期嘅檢測嘅。Thank you, Dr. Gordon.
So the current statistics from Stats Canada is that at age 75, a healthy woman, on average, lives another 13 years. And at age 80, she lives for 10 years. So women should definitely keep getting screened at least until age 80. And then after that, you decide with your doctor whether it's the benefits outweigh the risks of screening.
咁醫生咧就接住嚟講啦，話嗱，從呢個數據就睇到啦，如果係75歲嘅女性咧，佢可能仲有13年嘅命嘅喎。咁如果喺80歲嚟講咧，佢起碼仲有10年嘅預期壽命。所以佢嘅建議咧就話，起碼到80歲啦，先至停止做呢種乳房嘅檢測，同埋咧到咗80歲咧都要同自己嘅醫生傾下。睇下係咪嗰個風險咧，同埋嗰個益處咧係點樣嘅，所以咧大家都去考慮下，做到80歲都要做呢啲正常即係檢測年檢，同埋80歲嗰時記得同自己嘅醫生傾下，係咪是否應該再持續咁樣做呢個乳房嘅檢測嘅。Thank you, Dr. Gordon.
Okay, so reducing deaths is not the only benefit of early detection. And the task force, when they came up with those guidelines, all they considered was the mortality reduction. And they weren't even looking at those current studies that I showed you, where women are 40 to 60% less likely to die. They thought the likelihood of death was only 15 to 20% less because they didn't look at that modern research. But in addition to reducing deaths, finding cancer early gives better quality of life. For example, if a woman has a small breast cancer, she can have a lumpectomy instead of removing the whole breast. She can have less armpit surgery, and some of the older armpit surgery leads to permanent swelling in the hand and arm, and we can avoid that. And when we find breast cancer early, some women can avoid chemotherapy. So those are other benefits of early detection that improve the quality of life.
嗱，醫生就講啦。嗱，如果我哋早期發現咧，就好處係好多嘅，唔單單淨係挽救生命嘅喎。咁佢下邊就仔細咁樣講俾我哋聽啦。咁咧，起碼有3點啊。如果係可以早期發現咧，乳腺癌咧，起碼就可以冇做咁多嘅胸部嘅手術。譬如講，如果係可以局部攞走嗰個腫塊咧，癌症嘅腫塊咧，就唔需要成個乳房切除啦嚇。咁咧，第二個，如果係可以早期發現咧，就唔需要做腋下嗰個手術，因為點解咧？如果係腋下手術，可能佢會導致長期嘅手部嘅腫脹啊咁樣嘅。咁第3點咧就係可能早期發現乳腺癌咧，早期治療咧，咁就可以減低甚至乎避免去做化療咁樣嘅程序嘅。Thank you, Dr. Gordon.
So I'm going to switch now and start talking about breast density.
嗱，咁佢就開始同我哋講下乜嘢係呢個 breast density 就係乳房嘅點講咧嚇，即係佢嗰個組織嘅厚度。Thank you.
Breast density is very important because you have to understand it in order to understand what role it plays in detecting breast cancer early.
咁咧佢話大家一定要知道呢個係乜嘢意思嚇，因為佢咧到時做乳房造影嗰時咧，咁佢就會通過呢個嚟知道我哋嗰個對我哋嘅影響啦。Thank you, Dr. Gordon.
Okay, so we're pretty good at recognizing breast cancer on a mammogram when it's visible. I showed you a case earlier where it was easy to see the cancer. And this is the same. You can see the cancer. This is the top to bottom picture, the side to side, and this is a magnification picture. And this is what a typical cancer looks like with these jaggedy edges.
Dr. Gordon 就分享咗幾個圖片，之前佢都分享咗。咁今次呢個左邊呢個咧，佢就話又係從上到下，呢個咧大家可以睇到白色嗰個好明顯啦。咁第二張圖片咧，左邊嘅第二張圖片咧就係放大咗嘅。咁啊放大咗咧，同埋左右邊咧，大家都可以睇到白色嗰個周圍咧係好多好多好細幼嗰啲白色嘅線咧。嗰度咧就係都係脈部嗰度嘅組織嘅。Thank you, Dr. Gordon.
And the reason we can see this cancer so easily is because it's white and the rest of her breast is dark gray.
咁佢話點解我哋可以睇到咁清晰嘅癌症嗰個圖片咧？就係因為佢嗰個背景咧，其他地方都係灰色嘅，就係癌症呢度係白色嘅。Thank you, Dr. Gordon.
Here's another woman whose breasts are mainly dark gray. And I just took a picture of that other cancer and I put it here to show you that if she had a cancer, we'd have no trouble seeing it because her breasts are all dark gray, and dark gray on a mammogram is fat.
嗱，咁佢又攞咗第二個女性嘅圖片俾我哋睇嘅。咁呢個女性嘅圖片咧，佢嗰個背景咧就睇到係深灰色㗎啦嚇。咁佢就將之前嗰個女性嘅圖片咧加咗嚟呢度，咁啊大家都可以睇到啦，白色嘅癌症組織咧係好明顯嘅喺呢個灰色嗰度，灰黑色嘅背景，咁灰黑色嘅背景咧其實就係脂肪嚟嘅。Thank you, Dr. Gordon.
This lady's breasts are also normal, but you can see they're not all dark gray. There's a little more white tissue, and that's what normal breast tissue looks like. It's the opposite of fat, and we call it dense.
嗱，咁佢就攞咗呢個女性嘅圖片，呢個就係正常嘅乳房造影嘅喎。不過大家都睇到有啲黑色嘅背景啦，同埋白色嘅紋路喺嗰度。咁佢就話啲白色嘅紋路咧係正常嘅乳房組織嘅嚇。不過咧呢啲白色嘅嘢咧就唔係脂肪嚟嘅，而係我哋啱啱講過呢個 breast dense， 佢就話呢個就係呢個致密性嘅乳房組織，就係白色嘅呢啲正常嘅乳房組織。Thank you, Dr. Gordon.
If this lady had that same cancer from a few slides ago, we'd have a pretty good chance of seeing it on her mammogram.
嗱，咁咧呢個圖片咧就係佢又係從第一個有病嗰個圖片嗰度整咗呢度，咁大家可以睇到，如果係呢個正常嘅圖片當中加入咗呢個不正常嘅癌症嗰度，我哋都可以清晰咁睇到呢個不正常嘅呢個癌症嘅圖片喺度嘅。
Now this lady's breasts are also normal, but she has a lot more white, and it'll be harder to see cancer in her, maybe even impossible. We would not be able to see her cancer because it was hiding here.
嗱，呢個圖片咧又係正常嘅，不過問題就係好多白色嘅組織喺嗰度，所以變得咧我哋就睇唔到呢一嚿雲咁樣白色呢度咧，即係箭頭指住嗰度咧。如果有癌細胞啊或者係癌組織喺嗰度，我哋係睇唔到嘅。Thank you.
Here's another lady with very dense breasts, even more dense, and about 50% of cancers are missed when they're in woman whose normal tissue looks like this.
嗱，呢個圖片咧就醫生想同大家講，都係正常嘅。不過咧就係因為佢太多呢啲dense 嘅組織啊，即係高致密度嘅組織，變得咧係好難去判斷到底係有冇癌症嘅嗰個。大家可以睇到嗰個小隔離嗰個左手邊嗰個就係癌症嘅。你咁樣睇真係好難睇到判斷到，所以佢話喺呢種如果係女性嘅嗰個胸部咧，即係乳房嗰度。個致密度咁高咧，就好難判斷，大概有50%嘅機會咧係判嘅癌症係喺入邊係睇唔出嚟嘅。Thank you, Dr. Gordon.
So this slide shows all those breasts in one picture, and you can see how different they look. The completely fatty, a little dense tissue, more tissue, and then extremely dense.
嗱，大家就睇到呢度有4個唔同嘅造型啦嚇。咁啊，第一個咧就冇咁多致密度嘅嚇，咁第二個 B 嗰度咧就多咗少少致密度，即係白色嘅多咗啲。C 同埋 D 咧就好多致密度，所以呢個 dense 就會影響到佢嗰個判斷嘅結果嘅。Thank you,
So
Dr.
the denser the breast, the more easy it is for cancers to hide. And this video shows you how a small cancer easily seen in a fatty breast can hide completely from us in a dense breast.
嗱，咁醫生咧就用呢個圖片就同大家分享，左邊嗰個咧嗰個乳房咧就可以好清晰咁樣睇到嗰個乳腺癌。因為咧如果係呢個密度唔係咁高嘅咧，就更加容易睇到。不過右手邊呢個咧就因為個乳房本身嘅密度太高啦，所以咧變成咧嗰啲癌症組織咧喺入邊咧就好容易藏身喺嗰度，即係喺呢個乳房造影上邊咧就比較難於睇到啊。Thank you, Dr. Gordon.
But all those breasts I showed you, all of these breasts are normal. It's not an abnormality to have dense breasts. In fact, over 40% of women aged 40 to 74 have either category C or D dense breasts.
嗱，啱啱嗰個圖片咧，大家睇到 A、B、C、D 啦嚇，咁咧 C 同埋 D 嗰個咧就係大家40%嘅女性喺40歲到70歲之間咧會有嗰個 C 同埋 D 嗰種白色嘅嗰種比較密度高嘅乳房嘅喎。
So I'm hoping that by now you're wondering whether you have denser breasts or not. And it's important for women to know if they have dense breasts. Here's an example of an acquaintance of mine who went for a screening mammogram when she was 50 and it was negative. There's nothing showing up, no cancer. But 8 months later, she found a lump in her breast and she came to see us again. We repeated the mammogram. This time they put a sticker on her skin to show us where the lump was, and her mammogram was still negative, even using 3D mammography.
嗱，咁醫生又同我哋分享啦。嗱，因為咧非常之大家要重要乜嘢叫做我哋嘅乳房嘅密度，同埋影響我哋呢個胸部乳房造影嘅結果嘅話嚇。嗱，就呢個女性嚟講啦，50歲嗰時咧，佢就做咗一次乳房嘅造影，就結果就係陰性嚟嘅，即係冇發現到事。8個月之後咧，佢自己就覺得好似有個腫塊喺嗰度。嗱，咁腫塊嗰度，咁佢哋就8個月之後就同佢重新做咗一次乳房造影，同埋咧就攞咗一個做咗一個標誌喺嗰度。咁咧結果都係陰性，同埋甚至乎喺 3D 佢哋用咗嗰種多層面嘅顯像，結果都係陰性嚟嘅。Thank you, Dr. Gordon.
So we know that cancers can hide in dense breast tissue, and because she could feel a lump, we didn't trust her mammogram, so we went straight to do an ultrasound on her. And lo and behold, she had a cancer that was bigger than 3 centimeters in size, and it had already spread to her lymph nodes.
嗱，咁因為佢嗰個第二次做嘅即係乳房造影咧，結果都係唔準，即係 陰性啦，咁佢哋咧就直接去做咗一個超聲波嘅檢查。咁啊超聲波嗰度咧，佢哋就睇到有一個3公分嘅癌症喺嗰度嘅，同埋咧呢個3公分嘅癌症咧都已經入侵到佢個淋巴系統嗰度㗎啦。Thank you, Dr. Gordon.
So even though we know that doing mammograms is a good idea, women need to know if they have dense breasts. Because if a woman has dense breasts and she gets a normal mammogram report, we don't want her to ignore a lump if she gets one. We know that we can see about 98% or more of cancers in women with the fatty breasts, but that mammograms in women with dense breasts can miss about 50% of cancers.
咁醫生咧就提醒我哋咯喎嚇，雖然咧就係去做乳房造影係好好同埋咧，不過咧我哋知道啱啱了解咗，我哋乳房如果嗰個密度太高咧，雖然佢個結果咧可能會係正常嘅，做完乳房造影之後，不過咧因為大家啱啱都知道啦，因為如果係乳房嘅密度越高咧，嗰個乳房造影嘅結果咧，雖然係正常，可能都要大家自己去做檢測，嗰個手咧，如果係摸到有腫塊咧，都要去同醫生講下，因為佢哋講咗啦，98%嘅如果係胸部係比較豐滿嘅啲人咧，好多脂肪喺嗰度嘅咧，佢哋咧都會同埋嗰個50%嘅，如果係乳房嘅密度太高嘅咧，佢哋嗰個胸部嗰個乳房造影嘅結果可能都係唔正常嘅嚇，所以大家都要注重去自測。如果係感覺到胸部有啲腫塊咧，都要及時求醫㗎啦嚇。Thank you, Dr. Gordon.
So there are 2 risks of having dense breasts, and this is the bigger risk, the risk that a woman could have a cancer and we won't see it on her mammogram. But there's another risk to having dense breasts, and that is that dense breasts increase the risk of getting cancer. So we call it the perfect storm. Not only are women with dense breasts at increased risk of getting cancer, but if they get it, we might miss it. And cancer is about 4 to 6 times more likely in women with the highest level of density than in fatty breasts.
醫生就提醒我哋啦，點解我哋啱啱知道我哋嘅乳房密度咧會影響到我哋呢個早期檢測癌症咧，就係因為佢有2個高危嘅風險。第一個咧就係就算做咗乳腺嘅造影啦，可能都影響佢個正確嘅解讀啦。第二個咧就係本身呢個乳房嘅高密度咧，會有增加我哋得咗乳腺癌嘅風險嘅喎。咁佢就用咗啲數據啦，譬如講如果係女性嘅乳房係好多密度嘅咧，咁佢就有4到6倍嘅咁嘅風險，高於如果係嗰個乳房係多脂肪嘅婦女嘅。Thank you, Dr. Gordon.
So I've already showed you what breast self-examination is about and how dense breasts look on a mammogram. And you might be wondering, how can I tell if I have dense breasts? You cannot tell, nor can your doctor tell by examining a breast. You can't tell by how they feel, whether they feel soft, firm, or lumpy. The only way you can tell if a woman has dense breasts is from her mammogram.
嗱，啱啱醫生都講啦，之前我哋有講咗乳房自測啦嚇，咁乳房自測咧，就算我哋自己做或者我哋嘅醫生幫我哋做啦，其實我哋咧都係感覺唔到嘅，咁唯一可以感覺到嗰個冧嗰啲嘢咧，都係要通過乳房造影呢部分嘅。
So I've already shown you a case where a woman had a feelable lump and we could see it on ultrasound. We now know that if we do breast ultrasound on women who have dense breasts, we're going to find many of the cancers that are missed on the mammograms.
嗱，咁佢就講啦，咁之前咧佢分享咗一個圖片，嗰個女性咧就自己摸到有一個結喺嗰度，然之後咧佢就話，如果係呢種婦女咧係 嗰個密度比較高嘅胸部乳房嗰度咧，咁佢哋就會做ultrasound， 即係超聲波，咁佢哋就可以發覺到好多係有癌症嘅個案喺嗰度嘅。Thank you, Dr. Gordon.
Sorry, I skipped ahead a little too quickly. So some of you who are on the Zoom a little bit early might have seen us talking to Jenny Dale. Jenny Dale is a woman who had breast cancer in 2014. It was missed on her mammogram, but it was found on her ultrasound. And she started an organization called Dense Breast Canada. It's completely nonprofit and it's volunteer run, and it's all about education and advocacy. Now, thanks to their patient advocates, British Columbia became the first province in 2018 to tell all women their breast density in their screening mammogram results letter. And since then, 5 other provinces do now as well. But BC and Alberta are the only provinces where women with dense breasts can have breast ultrasound and have it covered by our provincial health insurance.
嗱，咁醫生咧就解釋咗呢個圖片啦。咁咧有啲組織咧係非牟利嘅，譬如講呢個 Jenny Dale， 咁佢2014年佢自己就係有確診嘅，不過咧就喺嗰個胸部嘅圖片咧，即係乳房造影術上邊就睇唔到，後尾咧就佢個癌症係從超聲波嗰度發現嘅，咁佢後尾就成立呢個非牟利組織去推廣，等大家公眾多認識到呢個乳房密度對呢個早期發現癌症嘅影響。咁咧因為佢哋嘅努力啦，咁咧變成我哋 BC 省咧都會呢一部分咧可以超聲波係可以免費做嘅，對於如果係呢啲乳房嘅組織係比較高密度嘅。Thank you, Dr. Gordon.
Okay, so we knew from old research, in fact, this paper that I wrote in 1995 was the first paper in the medical literature to show that we could find cancers on ultrasound that were missed in women with dense breasts.
嗱，呢個文章係1995年嘅，睇到大家都睇到呢個 Dr. Gordon 嘅名喺嗰度。咁咧佢就話咧嗰時已經有數據顯示啦，有一啲乳腺咧腫塊咧係只可以喺超聲波下邊睇到嘅。Thank you, Dr. Gordon.
And my colleagues in Vancouver published our results from the first year that we did high volume ultrasound screening. And just to give you some perspective, on mammograms, we find about 5 cancers per 1,000 screens. Now, in women in the 40s, it's closer to 2, but as you know, cancer gets more common as women get older. And overall, it's about 5 cancers per 1,000. In the first year that we were doing high volume ultrasound screening, we found 7 cancers per 1,000 on the ultrasound. Now that's cancers that were missed on the mammograms. So if we're finding 5 per 1,000 with mammography and then another 7 in women with dense breasts. Importantly, 40% of those cancers we found had no family history and 60% were not in the highest category, but in category C. So it's important and it's ideal that all women in category C and D should have access to supplemental ultrasound screening.
就醫生咧又同我哋分享啦，因為佢啲同事咧喺 Vancouver 都做咗好多呢方面嘅研究，咁佢哋就發現咧5個癌症病患從1000次嘅檢測當中咧，有5個乳腺癌患者咧係從 ultrasound 嗰度，所以佢哋咧就會話如果係40%入邊係冇家庭嘅因素風險，冇家族史嘅咧，佢哋睇到呢種組織即係胸部乳腺組織密度高嘅咧，60%咧喺嗰個 category C 應該去做一個 ultrasound 嘅補充，因為嗰個大家都知道，如果係胸部組織太過密度高咧，嗰個胸片 即係乳房造影嘅嗰個睇唔到嘛，所以佢哋就會建議喺呢一部分嘅女性咧群體當中咧，應該就增加呢個超聲波嘅檢查。Thank you, Dr. Gordon.
So I'm getting close to the end of the talk, but I want you to know of all this information we gave you today, your doctor may not know about it. Doctors in general believe what they're told by the task force, and I've told you why the task force got it wrong, but your doctor may not know that women with dense breasts are at a greater risk of getting breast cancer.
Dr. Gordon 咧就提醒我哋大家，好多醫生咧自己咧可能都冇意識到乳房嘅密度會影響到早期診斷嘅，所以因為好多醫生佢都係跟住指引，啱啱我哋講咗嗰個 task force 指引，如果嗰啲醫生係跟住嗰個指引嚟做咧，佢哋可能自己都冇意識到，如果係呢個婦女嗰個乳房組織係高密度嘅咧。佢會真係影響到佢嗰個檢查結果嘅。Thank you, Dr. Gordon.
Your doctor might not know that it's more likely for a cancer to be missed on a mammogram in a woman with dense breasts.
你個醫生可能都冇意識到，如果係乳房嘅密度咁高咧，好多癌症喺呢個人群當中，佢嗰個胸片咧會影唔到出嚟嘅，即係乳房造影術咧係會被錯過咗嘅。
And your doctor might not know that ultrasound can find many of the cancers that are missed on mammograms in women with dense breasts. Now, I told you that starting in 2018, women in British Columbia are all told if they have a screening mammogram, their breast density is included in their mammogram report. So if you have dense breasts and you want us to try to find your cancers early, the ones that are unlucky enough to get it, then you should ask your doctor to send you for a breast ultrasound exam.
咁醫生咧就Gordon 咧就提醒我哋嚇，咁大家都知啦，2018年之後，我哋 BC 省呢度咧嗰個對乳房造影之後嘅呢種超聲波咧，喺呢個人群即係乳腺特別密度高嗰個咧，係可以免費得到超聲波嘅檢查嘅。所以咧好多醫生自己都唔知道，所以咧如果你係自己覺得有必要嘅話，你可以話俾你個醫生聽，要求去做呢個乳腺造影之後，需要再做一個超聲波，因為你可能就呢個群體乳房嘅密度比較高。Thank you, Dr. Gordon.
So what you should do is look at your last report. Those of you who haven't had a screening mammogram, you need a mammogram. If you're over the age of 40 and you don't need a referral from your doctor, you can book your own appointment. If you've had a mammogram through the screening program subsequent to October 2018, look at that report because it will tell you what your breast density category is. And if you are category C or D, you have dense breasts.
醫生又提醒我哋啦，咁如果咧你40歲啦，不過從嚟未做過呢個乳腺造影咧，你就可以直接去預約嘅喎，你唔需要醫生嘅轉介嘅。咁如果你係2018年之後有做過呢個乳房造影嘅，你可以睇下你嗰個報告，你個報告上邊咧就會有寫到你個乳房嘅 density 嗰度嘅。咁乳房嘅密度，咁如果你係屬於佢嗰個 category C and D， 即係你係嗰個 report 上邊咧，你個報告上邊寫住你係屬於呢個乳房密度嘅種類係 C 同埋 D 嘅咧，你就應該去知道你係應該要嗰個 ultrasound 咁樣嘅。Thank you, Dr. Gordon.
So let's say you find out you have dense breasts. What should you do? Well, first of all, you should continue having mammograms. Even though they're not perfect and they can miss cancer, they do find some cancers that don't show on ultrasound. So we don't want you to switch from mammography to ultrasound. We want you to have both mammography and ultrasound if you have dense breasts.
醫生就提醒我哋啦，如果你知道自己有呢個乳房嘅高密度嘅人群點算？首先咧佢就話 堅持做呢個乳房造影術，因為乳房造影術有時佢可以診斷到一啲乳房癌，反而喺嗰個超聲波上邊睇唔到，所以咧佢就建議你係堅持做呢個乳房造影術，同埋啊，強調呢個同埋超聲波呢個。
And since we know that not all cancers are visible on mammograms, please check your breasts periodically. Look for any change that might be cancer that might have been missed on your mammogram, and go see your doctor if you find a lump or one of those other signs.
咁醫生又強調啦，因為我哋都知道啦，乳房造影術咧，係有時睇唔到一啲變化嘅即係乳腺嗰種癌症嘅症狀嘅，所以大家咧都要定期咧就做下自己嘅乳房自測，咁咧如果有咩變化咧，就及時同你個醫生聯絡啦。
And because we know that having dense breasts increases your risk of getting breast cancer, let's try to decrease your risk by modifying any lifestyle factors. Like if you're overweight, try to get to and stay at a healthy body weight. If you're not currently exercising, start doing moderate exercise.
咁咧醫生就同我哋講啦，因為我哋大家都知道啦，如果我哋嘅
Sorry, Belinda, please mute yourself.
Why can I just got this cold coffee? I wonder.
Oh, yeah, I'll keep that, Brenda.
Thank you very much.
我就同大家翻譯下。
Okay, that's better. So try to lose weight if you need to, do some exercise if you're not, decrease your alcohol intake, and if you can stop using hormones, that's also a good idea.
OK， 咁醫生就同我哋講啦，因為大家都知道啦，如果係乳房嘅密度比較高咧，本身就增加患上乳腺癌嘅風險㗎啦，所以喺呢個人群當中咧，最好咧就可以大家改變一下自己嘅生活方式。包括乜嘢咧？就係如果我哋體重過高咧，我哋可以減輕體重；如果係減到體重到正常範圍咧，就最好。咁如果我哋平時唔做運動咧，我哋可能都要做下運動。平時飲酒過多咧，都要減少飲酒喎。同埋，如果我哋可以停止使用呢種激素類嘅治療咧，都可以幫助嘅嚇。最好都係減低激素嘅應用。Thank you, Dr. Gordon.
So here's what I want you to remember from this talk, that everybody should have mammograms starting at 40. But remember, not all cancers are visible on mammograms. And even the abnormalities that show up on a mammogram are not always cancer.
醫生就提過我哋啦，通過今次講座咧，佢想大家記住以下幾點喎。咁第一點咧就係40歲開始咧，就大家應該定期去做呢個乳房造影㗎啦。咁咧大家都知道，乳房造影咧未必可以監測到真正嘅嗰啲乳腺癌。大家亦都知道好多呢種不正常嘅乳房造影嘅結果咧，亦都未必係真正嘅癌症。Thank you.
So also remember that ultrasound can find many of the cancers missed on mammograms in women with dense breasts. And you have to remember there's two risks of having dense breasts. The more important one is that cancers can hide on the mammogram. And the second is that having dense breasts actually increase the risk of getting breast cancer. So it's important that you find out your breast density on your mammogram report and you understand these two risks.
醫生有提醒我哋啦，啱啱我哋都講咗啦，佢就做個總結啫。咁咧超聲波咧，大家都知道可以幫助揾到確診同嗰啲組織，即係乳房組織比較高密度嘅人群。咁佢哋喺嗰個乳房造影上邊，可能嗰啲結果咧顯示唔到出嚟嗰時咧，超聲波可以幫助發現呢啲癌症啦。不過大家都知道，如果係乳房組織太過密度高咧，都有兩個風險嘅喎。咁啊，第一個風險咧就係增加咗喺檢測，尤其係乳房造影術上邊個結果咧，影響佢個準確性。 同埋咧第二點嘅風險咧就係、如果乳房嘅密度非常高咧，反而本身佢就係一個風險，導致增加有乳腺癌嘅風險嘅喎。Thank you.
So everything I've been talking about so far is to help you reduce your risk of getting breast cancer. And if you're unlucky enough to get it, to help us find it early. But now I want you to help not just yourself, but other women. And here's what you can do to help.
嗱，醫生咧就話啦，咁我哋依家咧就講，早期篩查咧，唔單單係可以減低得到乳腺癌嘅風險啦，就算我哋真係確診乳腺癌，都起碼可以及時治療。同埋依家咧，佢就想同我哋分享下，我哋點樣去幫助自己同埋其他人去預防乳腺癌。
And if you go to the Dense Breast Canada website, on their homepage, there's a button here called Add Your Voice. If you click on that button, it's going to take you to a new page that's like a petition, but it's actually better and easier because all you have to do is put in your name and your postal code and your email address, and it's going to automatically send a letter to your MP in Ottawa and the federal health minister asking that they restructure the Canadian task force so it will come up with better guidelines to save more lives and reduce suffering from breast cancer.
嗱，醫生咧就同我哋介紹呢個網站，如果你想幫助你其他人或者自己咧，咁呢個網站大家可以去睇到佢個箭頭就指住啦嚇，上邊呢咧就係幫助你自己發出聲音啦，下邊呢個箭頭咧就係點樣去倡議。咁咧你撳咗下邊呢個箭頭指住嗰個咧倡議嗰度咧，咁佢下邊就有個一個表格，咁你就填咗你個姓名、你嗰個郵編號碼同埋你個電子 email 啦。咁佢呢個信息咧就會發俾你喺Federal 啊，即係Ottawa 嗰度咧上邊嘅代表，同埋咧衛生局入邊咧，佢哋都有人會收到呢封信。咁咧佢就會等呢啲政策制定者咧，去同呢個啱啱講咗嗰個指引嗰度嘅部門咧，等佢哋做多啲指引，等到更多人可以運用佢哋嘅指引去預防乳腺癌嘅。Thank you, Dr. Gordon.
So that was a lot of information, but it's just the tip of the iceberg. I'm so grateful to Ping for arranging this and for recording it so it can be shared with other people who weren't able to watch today. And grateful, so grateful to Melody for doing the interpretation. Thank you both so much. And I see there's only something in the chat. I could click on it now. But if anybody has any questions they want to ask in person, if you click on the reactions button and raise your hand, either I or Ping will be able to recognize you and take your questions. The one that's in the chat says, what do you do if your doctor refuses to refer you for a mammogram if you are over age 74? That's a really good question. You want to know exactly what to say to talk your doctor into it, to advocate for yourself. And there are some scripts that will help you advocate. They're on a slightly different website. The website you want is mybreastscreening.ca. You click on, it'll ask you what province you're in, and there should be some scripts there of how to talk to your doctor to demand that you be sent for a mammogram, because the risks keep going up. If you're well and you don't have any other illnesses that are going to limit your life expectancy, you should keep having mammograms.